Welcome to my second video log. The weight room activity I've chosen to focus on is the back squat, and the footage is of myself performing the exercise. The aims really are just to identify and describe key movement errors against the technical model and provide corrective exercises and derivative exercises. So the back squat is a multi-joint exercise that primarily focuses on strengthening musculature at the hip and knee joints. So if we just take a look at my starting position, it's generally okay. My arm position, however, on the bar is quite close together. Ideally placing my hands further out along the bar would allow for greater external rotation at the shoulder and therefore a greater range of motion to be achieved. My feet are slightly wider than shoulder width apart, which should allow for a good depth to be achieved during the descent phase. However, it is clear to see that my left foot is slightly more turned out than my right. Okay, so if we just have a look at the descent phase, it is clear to see that the hips are initiating the movement over the knee and quadriceps, which is good. During a high bar back squat, if performed correctly, there should be an equal or pretty much equal distribution of force between sort of hips and knees. As the descent continues, the knees are falling slightly over the toes and the torso still remains quite rigid throughout with minimum anterior trunk lean or flexion of the thoracic vertebrae. However, the lordotic curve of the lumbar spine towards the end of the descent phase is a little exaggerated, which would mean that flexion of the lumbar spine is occurring. So at the end of the descent phase, the squat depth should sort of be parallel to the floor or even sort of lower than that, depending on an athlete's training and performance objectives. And from this footage, it is evident that I am squatting to just above parallel. The reason for that is twofold. Firstly, I am recovering from a recent hamstring strain, so I'm not really wanting to risk going any lower. And secondly, my feet aren't really turned out enough, which restricts the movement available during hip flexion, as I haven't placed my femur into lateral rotation, which may be the reason why also there could be a lack of squat depth there. It's a little bit difficult to see from the camera angle, but there's no sort of compensatory movements at the subtalar joint from excessive pronation. From this front view, it is also possible to notice my left leg is being forced into a valgus position, which places excessive stress on ligaments within the knee, particularly medial collateral ligament and anterior cruciate ligament. For me in particular, this was most likely due to weakness in the gluteal muscles, in particular the gluteus medius. To correct this, I should complete a range of strengthening exercises targeting the hip adductors, such as the clam in this video, using resistance bands to engage the muscle, along with also monster walks. Another reason for this compensatory movement could be due to tight adductor muscles that pull the leg into a valgus position. The resistance bands can also be used during squatting to assist the athlete to push their knees out to prevent the collapsing of the leg. So probably the most interesting compensatory movement from this video is this asymmetric hip shift that I have to the left side. This hip shift can place additional stress to the lumbar pelvic hip complex and lead to sort of SI joint pain and hamstring injuries. This asymmetrical movement normally is due to imbalances of the muscles surrounding the hip, which have occurred due to certain muscles being overactive and therefore tight and dominant, or underactive and therefore lengthened and weak. So the muscles on the same side of the shift, the left, tight muscles would obviously include the hip adductors, which would be pulling the hip to the left during the descent, and the glute medius would be underactive or weak, which means it's not actually able to compensate for that tightness and pulling of the adductors. Regarding the muscles on the right side, so opposite to the actual shift, the overactive muscles would usually include glute medius, piriformis hamstrings, and obviously your gastric and soleus complex. And the underactive and weak muscles on the opposite side are adductors, which aren't obviously strong enough to be able to contribute to hip stability. Derivative exercise that can be used to help with that hip shift is single leg squats with hands on hips, which allow the athlete to be able to feel when that hip is actually shifting, and performing that in front of the mirror will also help to visually aid that. So during the ascent phase, you can see some additional arm movements, particularly on the right side. This could actually be due to the weight on the bar being too light, therefore the tension and bracing of the spine and core is not actually apparent, which is allowing that accessory movement to occur. So just a quick comparison here, this athlete is performing a more accurate representation of a good back squat against the technical model. Stability of both the upper and lower limbs is very good, and there's no accessory movements occurring at the arm, unlike myself, and obviously he's achieving a very good squat depth.